panel, but I guess I'll introduce myself first. My name is Rhonda Rawlings. I am a media personality in Greenville, South Carolina. I've been the News and Community Affairs Director for 1073 Jams for 12 years. I'm the community host there now on Sunday mornings. I'm also the Neighborhood Engagement Director for Mill Village Ministries and the founder of Uplift Upstate. It is a social media initiative. So really excited to be here tonight. And now we'll go to our esteemed panel. Sitting to my left, everybody's sitting to my left, but my direct left is Alicia Henry. Alicia has a heart for service that began in childhood and a belief in the power of community. Her passion for public service has manifested into an impactful career. Upon graduation from Furman, she obtained a Master's of Public Administration from Clemson University. She currently serves as Vice President of Community Impact at United Way of Greenville County. In her role, she is responsible for leading strategy, execution, and operations for United Way's multi-million-dollar portfolio of grants and community initiatives, and works to advance equity and economic mobility in Greenville County through multi-sector collaboration and community partnerships. Welcome tonight. Next is Dr. Leon Buffalo. I often call him my doctor, who's not really my doctor because he's a friend of mine. I call him with all sorts of questions. Dr. Leon Buffalo Jr. was born in Washington, D.C. and raised in PG County, Maryland. He left home at the age of 18 to serve his country and became an Army combat medic in 1989. During 12 years of active duty, Dr. Buffalo served in Operation Desert Storm during the war in Iraq and Operation Restore Hope during the conflict in Somalia. After his tour to Somalia, Dr. Buffalo was accepted into the Army's Licensed Practical Nurse Program and worked in various areas of nursing. While on another tour in Honduras in 1999, he met his wife, Asante Buffalo, an Army surgical technologist, now a family medicine physician. They both decided to end their active duty status to further their career in medicine. Leaving the Fort Hood, Texas area, Dr. Buffalo joined his wife, who was at the time stationed in Fort Jackson. He next graduated cum laude from the University of South Carolina in 2004. And as you can imagine, his bio is a long one. So we're going to make sure to place everybody's bio, I guess, within the comments so we can go back and look. But we are just excited to have Dr. Buffalo in South Carolina. His practice, Grace Medical, is in Simpsonville. And next is Derrick Quarles. Derrick is a candidate for South Carolina House District 25. Growing up in Greenville, South Carolina with his mother, father, and 5 brothers, Derrick, political whiz, was curious about the world around him and the people in it. Despite his structured, happy upbringing, he began having disciplinary issues at school. At the age of 13, Quarles entered the juvenile justice system and was labeled a menace to society by a family court judge. Because of his actions, he was sentenced to serve 8 months in the juvenile detention center. With a renewed passion for helping others and a determination to prove the family court judge wrong, he graduated from high school, began working, and sought opportunities to be engaged in the community. In 2008, Quarles joined his local NAACP chapter and helped organize a protest reprimanding gangs, drugs, and violence in a Greenville neighborhood that was widely known for crime, poverty, food insecurity, and dilapidation. While continuing to work in the community, he enrolled at Claflin University and earned a Bachelor's of Arts degree in political science and criminal justice. With the growing number of police brutality cases against children and people of color in 2012, Quarles knew that he could not sit idly by. By 2015, the number of police brutality killings continued to rise in major cities and in South Carolina, prompting Quarles to establish the Upstate chapter of Black Lives Matter. Within BLM, he helped facilitate the process of launching the St. Louis BLM chapter and traveled to speak at rallies, protests, and demonstrations across the country. Subsequently, in 2015, Derrick was invited to the White House, where he was recognized as a White House champion of change because of his commitment to building bridges between youth and law enforcement. Continuing as a community organizer and activist, Quarles was employed by the South Carolina Senate and provided consulting services to the South Carolina Legislative Black Caucus. He served on various political and social justice campaigns and was instrumental in protesting a voter suppression bill to aid South Carolina nonprofit organizations. And for some reason, my computer just froze. And next we have Ms. Savage, but I believe I have the rest of the notes on my phone. Just one moment. Yes, I do. Franchetta Savage is the owner of Essential Health Education and co-founder of Essential Healthcare Services. She is a nurse educator with over 15 years of healthcare experience. Specializing nursing focus as a critical care ICU nurse and served as a lead ICU COVID nurse during the pandemic. Franchetta has direct affiliation with the American Heart Association and the American Stroke Association. And next on the panel, I did not get a bio for her, but Ms. Tracy Fan is a community activist and founder of Freedom Fighters Upstate. And next to Tracy, I feel like there's so much more I should say, but I don't have the bio in front of me. And next to Tracy is Apostle Sammy Smith, who is the apostle of this church where we are at this evening. And thank you so much for letting us use this venue. And Pastor Apostle Smith is well known in this area for so many things that he does, such a servant, such a heart for a community. So thank you so much for that. I think we're going to start with Dr. Leon Buffalo. And Dr. Buffalo, I know that you have a presentation that you want to pull up for us.
Sure do. I want to thank you, Dr. Apostle Sammy Smith, for inviting me out. I want to thank Brother DQ for asking me to do this. When you first asked me to do this, I guess 6 to 8 weeks ago, my first response was no. In my heart, because I felt like, because you asked me to do some presentation on COVID, I feel like we've beaten COVID to death for the past 2 years, and I knew that where we were then, we were going to be in a different place now. But I prayed about it, and I said, I'm going to go ahead and I think I have a very interesting presentation that I'm going to talk about tonight. We talk about health and wellness, something very dear to my heart. If you want to go ahead and advance to the next slide. Since we are in a church, and I want to thank, again, Apostle Smith. Sometimes I like to bring scripture, and I cannot read that, but it talks about our bodies being the temple of the Holy Spirit.
Yes.
And the Holy Spirit dwells within us. We're in church, not trying to take your job. But it tells us that we're supposed to handle our bodies in a way that's pleasing to God.
Sure is.
And I think if we thought about this more, I mean, we do many things to feed our mind. We look at television, it feeds our excitement. We eat food to feed our bodies, but we starve this spiritual part of our life. And I will tell you that I take care of many patients with many disorders, and I will tell you that the spiritual part is being starved.
Yes.
And this is something that we don't talk about enough. I know people may not have come here to hear this kind of thing, but I did want to put it out there that I do take care of a lot of people with mental illnesses, and once you get down to it, some of it could be spiritual. I'm not saying you don't need medicine, but sometimes you just need a prayer.
Yes.
And you need a pastor. You need someone that can minister to you in that area. So I want to thank you for having us out for this.
Definitely.
All right, so this next slide, it has 2 videos embedded in it. Actually, I was going to talk a little bit about kidney disease because this is, we're coming up on March,
Yes.
which is Kidney Disease Awareness Month. And I actually went into medicine because I wanted to be a nephrologist. Straight out of the military, my first job was in dialysis. And just moving to South Carolina, started working in dialysis. And when you walk into this inpatient dialysis unit, everybody on dialysis was black. And I was very afraid. I said, I've just moved to this state. And I didn't know much about kidney failure at the time. I wasn't in medical school. I was an undergrad. And I would go up to the the residents that were there on dialysis and asked them, what happened? Why are you doing this? What happened to your kidneys? And the number one and number two reason for that was diabetes and hypertension. Like, I didn't know that my blood pressure, not controlling it, would do this to me. Or I didn't know not taking care of my diabetes was going to do this to me. And so I set in my heart, this is around 2002, that I'm going to go to medical school, going to become an internist, and I'm going to specialize in nephrology. You can go to the next slide. And while in medical school, and I was in my third-year rotation, I was shadowing an internist, and he sent me into a room to try to convince the patient to take a cholesterol-lowering medicine. And while talking with him, I was talking about his diabetes, his hypertension, and telling him, if you don't get this under control, you could potentially lose your kidneys. Then I had this aha, if I become a kidney specialist, it's a little too late. By the time they come see me, they're already in trouble. But primary care, which is what an internist is, primary care, I can prevent them from ever going to see the kidney specialist if I do certain things. So that's the whole reason why I went into becoming an internist.
Can I ask you a quick question?
Sure.
So, in speaking of kidney disease, and correct, March is Kidney Awareness Month, I know that we often think about, when we talk about health disparities and Black people being disproportionately affected, we always talk about those major ones. We talk about high blood pressure, we talk about diabetes, obesity, but we don't really think about our kidneys, right? And we don't really think about how these other illnesses are affecting. So personally for me, kidney disease is close to my heart. My mom passed away with kidney disease. And what happened was, when they found out, they also found out at the same time that she only had one kidney.
Oh, wow.
And so that was the issue. She lived all those, she passed away at 58, but she lived all those years not knowing that she only had one. And so that was the issue. So what do we need to get that information out to our communities to let them know this is something you need to be looking at as well? Or when you're going to your primary care physician, what are some of the things that they should look out for? What are some of the things that you should look out for?
Well, I'm going to get into that.
Signs and symptoms.
Yeah, I'm going to get into that as we get further into the talk.
You told me to interrupt you.
No, I said if something hits you, go ahead. The biggest thing is going to see your physician annually. I don't care if you have nothing wrong with you. At least go in for a head-to-toe assessment to get some basic lab work and to get some urine. Because in the urine, if you're spilling protein very early, if you have hypertension, you have diabetes, we check your urine to make sure you're not spilling protein. Okay. The kidney's function is to withhold that protein within the body. So you should have 0 protein in your urine. And if you start spilling protein, that's an early sign that you're having some kidney problems. If you have diabetes, every year your doctor should be doing that. If you have hypertension, every year your doctor should be getting what we call a microalbumin. So that's one of the signs. If you start to have signs from kidney failure, I will tell you this. I had a patient just recently who was lethargic. She came to see me. She had her husband and her son, and she was given some medicine to help her urinate more. She had some heart issues. And so she was sort of over-diuresed, meaning she was given too much, and she lost too much fluid, and she was in renal failure. And she was lethargic, falling asleep, and she was talking to me, she was falling asleep. Now, that's late signs, and I kind of figured it was kidney failure, sent her to the emergency department. Sure enough, she was in stage 4 kidney disease. They were able to gently, what we call, hydrate her with some fluids to sort of perk up her kidneys. But if you're having signs, it's too late, And so it's you really, things like hypertension and diabetes and knowing your family history. If your mom and dad suffer with kidney disease, 9 times out of 10, it's because of poorly controlled diabetes, poorly controlled hypertension. Have that conversation with your children. For some reason in our community, the older adults don't want to talk about what's going on with them. And I can't tell you how many patients, new patients, I'm taking the history. Is your mom and dad still with us? No. How old were they when they passed away? 50 or 59. That's too young. What happened? I don't know. They just never talked about it.
Something we need to talk about, too, is that stigma of talking about our health in the Black community.
Exactly. Anyone want to jump in?
Well, I will. First of all, let me just say, I love this conversation because I feel like we don't do this enough. And he's right. A lot of times we have this conversation when it's too late. And the biggest problem with a lot of people coming back into the hospital system is for preventable diseases like kidney failure, which we can prevent by just taking the steps to take care of yourself yearly, going to see your doctor, making sure you are taking care of the lab work, getting the treatments or whatever it is that you need to do, especially with your blood pressure. People don't understand how, I always tell people when I'm educating, high blood pressure and diabetes are best friends. They usually come in packs. They ride together. So usually if you see one, you're going to see the other. And a lot of times that domino effect is why we are having the kidney disease issue, especially with people that look like us. And it's really a big disparity.
Doc, let me ask you something, because a lot of people who are after church, and like they've probably gone beyond repair, and I'm hoping I'm not saying that wrong. They're on metformin, they're on different medicines. When you get on these medications, can you ever come off of them?
That's a very good question. And I am one I will tell my patients, and I have patients coming all the time, they may be on one medicine for their blood sugar, one for their blood pressure, maybe a diuretic or something, and I'll take a look at their weight, and kind of their history. And I really do try to empower people to say, you know what, I'm gonna continue these medicines, we'll check these labs, but you really don't need to be on these medicines.
Okay.
And sometimes I'll get a shocking look, and they're like, well, what do you mean? Well, no offense, if you just lose a little bit of weight, not, getting back to your high school weight or getting back to your prom dress weight, but 5 to 7% of total body weight, which works out to be 10 to 12 pounds. We're talking about medicine. We're trying to just bring down the numbers. A 5 to 7% weight loss can do wonders for an A1C or wonders for a blood pressure. And if you continue to work towards a normal weight and a healthy diet and exercise, those numbers will come down and you can come off those medicines. I've had plenty of patients that do it. Now, if you return back to those unhealthy lifestyle habits of not eating correctly, not exercising, becoming sedentary, gaining back the weight, then yes, then your numbers will go up and you will have to go back on that medicine. So it can be done.
And I had this conversation, I'm going to let you get back to your
person,
with someone recently, just about how we need to rethink how we think about food.
Yeah.
Like, because I grew up and every single night I had a meat, a starch, and a vegetable every single night.
What's wrong with that? That's good.
Every single night, right? But we don't need all that, do we?
Yeah. Well, in portions. I mean, most people I talk to, they have a diet that doesn't have the proper macronutrients in it. So you have fat, you have carbohydrate, and you have protein.
Right.
We eat a very high-fat, high-carbohydrate diet, very little protein. So I do talk about the plate and the rule, you cut the plate in half. Right. That the half should be full of vegetables. You cut the other half in half. Now you have a plate that's broken down in thirds. The top third should be your protein, whether it's baked chicken, fish, or steak, or pork. And the other one should be a non-starchy carb. So we're talking brown rice, wheat pasta, or sweet potato. Right. So that's fine, and especially having it in the portion sizes. So
in the portion,
right?
But mostly the meat would be the star of the show.
Right. Well, a good guide is really your meat shouldn't be any bigger than the palm of your hand. Your fist is about a cup. So 2 fistfuls of green leafy vegetables and maybe a half a fistful of rice. Now, if you ever go to Olive Garden, they give you a half a cup of rice, you're probably going to ask for your money back.
That's
right. But that is an actual serving. So I do a lot of education around nutrition and having the proper macronutrients, and I work with the nutritionists, which I feel is a very underutilized profession, especially in this country, because they can tell you how many calories you really need to maintain your current body weight. And if you want to lose a little weight, then they'll cut back a few calories and you increase your activity, and that should give you a nice, slow weight loss. So, no, three meat, starch, vegetable, that's okay.
In the proportions.
It's just portion sizes, right? And try to bake, broil, grill, air fry.
That's key.
Not
That
fried,
key.
not fried so much.
Right.
Oh, yeah. I think a lot of it is, when we talk about family history and we talk about diabetes and high blood pressure in the family, You also got to look at how the family prepares the meal, because we like our food. We're from the South. We want to eat, right? So, but a lot of times the food, even the vegetables that we cook it over. We cook out the nutrients that we really need, right?
And
or
it's not in that
like if we're
portion.
cooking them greens, you can't just, you can't cook the greens the way they want you to eat it, right? So sometimes that is also a problem, because we add a lot of those unnecessary ingredients that cause that meal to no longer be good and beneficial for you. So sometimes families, like if you're looking at a family history, and I'm sure Doctor can relate to that, but if you're looking at a family history and you're looking at the child who's might be overweight or going through some diet, because we have kids that are overweight, diabetics, high blood pressure as well. But if you're looking at that, then you can look at the family history and see how we're really feeding our kids, and how are we preparing our meals? Are we eating out more? Are we more convenience type of meals? But yeah, that comes a trickle effect when it comes to eating healthy and really using the food to fuel your body versus harm it.
But you better not be the one to bring crunchy greens to the...
I know, right? You better not.
Fried spinach.
Don't say the doctor told you to do it. No, don't do that.
So this next point that I wanted to go into, and this has a little bit to do with COVID-19. So we really didn't know how we were going to see patients when COVID-19 first started. Everything shut down, NBA, NFL, sports, and we had to get out of the office. We had to go home, and we, of course, we figured out televisits and such. And so I'm sitting on my couch, and this is in April, and President Trump comes out, and Fauci comes out alongside of him. And I wish I could play this. I'm going to see if I can get the volume from my phone. But this brought tears to my eyes, and I'm going to play it.
A particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs, that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications. Thank you.
And that totally floored me. And it really brought tears to my eyes, because some of the words that he used, the adjectives of it is afflicting the African-American community. I mean, it is bringing pain and suffering into the African-American community. And he says this is sad. You know, and he says there's nothing we can do about it now, because we could do nothing back in April. And it wasn't that we were contracting COVID-19 more than our counterpart. It's that when we did get it, because we had all of these conditions that we just talked about, diabetes and hypertension and obesity and asthma, we had poorer outcomes. And so and I have another video where he says, we will get over COVID-19. He said COVID-19 will go away. He said health disparities will continue to be with us. And there is something that we can do about this now. You know, we've made it out of it. I called Melinda Gillespie. She does the Minority Conference. She used to do it every year in April. And I told her, you should have no problem getting any of the African Americans, any of the blacks to come out to participate and to hear more about their health and wellness. And if you have these conditions that we're talking about, I mean, it was killing us in a disproportionate rate. If you have these conditions, you've made it out of it, and I have buried some folks. This has been a very hard time. It's been a hard 2 years. I just last week lost a young lady. And we can come together in forums like this and have this conversation. You know, the church should be packed out. Yeah. Online should have 1,000 folks watching, because we're at the end of COVID, or we might be. You know, we're sort of coming out of it. We're talking about unmasking. We're limiting the days in quarantine and isolation. And so our attitudes with this very condition shouldn't be, okay, made it through that. No, it's how do you prepare now, yeah, in case this thing swings back again, in case it comes back in a more deadly variant. And so I'm having these conversations all the time, and so it's great that we're having this talk. And something else he said in another video that I was going to play, where he likened COVID-19 and how it exposed the healthcare disparities in blacks. He likened that to what HIV did to the gay community. It shined a light on what this country looked at as a stigma. It shined this light. They rallied together, right? They marched on Washington. They did whatever they could. We are not going to be ignored. We need treatment. We need help. They've gone from taking 8 pills a day to now you have 1 shot a week, 1 pill per day. And he's saying, and so he likened COVID shedding this light on healthcare disparities with African Americans, just like what happened. We need to rally together now. We need to march on whatever we have to do to say enough is enough. This is the one thing that we can't control is our health. We can't control how you're going to get pulled over. You can't control how you're going to get treated at the bank because of the color that you look, but you can't control what goes in your mouth. You can't control how often you exercise, how much sleep you. This is the one thing as black people that we have total control over. And so I'm hoping within this, and I'm going to tell you something else. We can't do this by ourselves. The gay community didn't just reach out to other homosexuals. They had heterosexuals. They had Loretta Scott King walking with them. And we can't, in this type of setting, we can't fix African-American healthcare disparities just with keeping it within the black community. We need other folks that don't look like us, and we need to educate them on our ethical standards, on ways that we believe, on ways that we were raised. We have to make them aware, and we have to make them sensitive to what's going on in our community. And so when people call me and asking me for a unicorn, you know what a unicorn is? It's a black urologist or a black dermatologist. And I'm like, we don't have that here. And there may be one, but that one black dermatologist can't see every black person in the upstate. You don't have a lot of primary care physicians that are black, and I try to see everybody that I can. And when I look at some of my other brothers that's out there and sisters, they so full, they can't even take new patients. So we have to, like them, we have to reach across the aisle. We have to grab our other brother and say, help me to help my people.
So Doc, what you said, and even what she was saying, our food is killing us.
Yeah.
More than cigarettes and more than dope and more, what we've been taught to eat from children, and then we develop a taste bud.
Right.
And that taste bud does not allow us to change to the hard greens, because I know with mine, I want mine laying on top of each other, and so we're not looking at health. But as I get older, I want to eat healthy. Right. I don't want to feel sluggish. I want to walk after a while. But trying to change that mindset amongst our people is almost impossible, seemingly.
I think mindset is, just the mindset of what we have been, what we've learned, and what we know as okay, what we like. But I want to piggyback off of something you said about the COVID unit. So as I said, as she mentioned before, I was a COVID ICU nurse, and so I was there on the units when all of this was happening. And so I just kind of want to paint a picture of what it looked like, if you don't mind. So, people were saying, okay, well, people are dying. They're dying really fast, and it's a lot of us that's, it's killing us, and we don't know, but my family's okay. I don't know anybody personally that's affected. So for me to have to deal with that mindset of everything outside of the hospital looked a certain way. But as soon as I walked onto that ICU unit, it was literally a war zone. I mean, we had a 28-bed unit, and the entire unit was full of COVID patients, and we had a whole 28 or more patients in the ED ready to come up to us. And I guarantee you, over half of those people in the ICU was African American and Latino, because it also affects them too. Our beige brother and sisters, right? So they are affected just as much as we are with the same type of diabetes and hypertension issues. But in the ICU, those people that looked like me were dying really quickly. Like, it was one day, I will never forget, the day after Thanksgiving, we all were recovering from that very delicious meal we ate, right? So we're recovering at home, but we had to count the body bags before we could start our shift, and we still ran out by the end of the day. So it was one of those type of environments where it was very hard to explain to a teenage boy why his mother, who just came in because she had a headache, is now being taken off of life support because she had multiple strokes. It's like one of those type of issues where you just cannot grasp the fact that you have to take your health serious. Because if you don't, you are literally at the mercy of whoever can take care of you in that unit. And that is unfair.
Dealing with the doctors at medical field, how concerning was it that our people really resisted the vaccines? I know you were probably going to get to that. I mean, the vaccines and the boost, how come they were just running from that? I don't understand why they could take any other kind of shot. But when it comes down to this, and I say, I don't understand why they
And let me piggyback on that question too, because that is probably, I think, one of the issues Derrick wants to get into as well.
Yes,
And
yes.
I think that, our people have a history of mistrust. And of course, Henrietta Lacks and the Tuskegee experience. So how do you explain to your patients who may have that fear, some to this day? And even though you say we're coming out of it, isn't it still important that we get our vaccines? And we're vaccinated and boosted.
Oh, I am definitely pro-vax, and I mean, I was in the military as well, so they kind of force those things on you. You kind of don't have a choice. But being in healthcare, and see, as a healthcare provider and as a quote-unquote scientist, how they came up with these new vaccines, it was fascinating to us. We were just blown away. We were just, wow. They were able to do it quickly. We understood the chemistry behind it. We understood how it worked. And of course, there were too many other variables in play. This thing was heavily politicized. I won't go there. It started too early. They got involved too early. Because I guarantee you, if politics were not involved, if social media didn't have all these quote-unquote Google doctors on there putting out all this information, if this would have started out with, we have a virus, it is killing Americans, and people all over the country, everyone go home. That's what we did. We're going to go home. We're figuring this out. We're coming up with a vaccine, and just mask up, wash your hands, stay within your area, and we're working as fast as we can. If it never got politicized, if it never was about money and keeping the economy going, this thing is not real, and you don't have to wear a mask. I mean, it just started a snowball that we just could not stop. We have
And when you have a
physicians.
president saying that it's a hoax,
Right.
it's not real.
That's what I mean
Then
by
you
it being.
cause that old
I'm
division.
trying not to point that out.
Well, I had to point that out. That was a big
no,
deal.
I mean that is. I mean, of course, you're going to listen. Being a military person, we're always taught that you never disrespect the office. I don't care who's in there, and what he said is very powerful. It divided the country. It divided my patient population. I had some that came in, and I would have arguments, and if I had a woman tell me why she's not getting the vaccine, didn't want to get it, as she is coughing. And I said, have you been around somebody? She had been around somebody with COVID, had a fever, was untruthful with my front desk, about her symptoms. Sent her to the CVS, positive COVID-19, was on the ventilator that Monday. Thank God she made it off of it. And when she came back, I said, "You gonna get a vaccine now?" And she's like, "No, because now I'm immunized." So I mean, so I will say yes. I mean, I had a lot of tough conversations, and I will tell you, most patients, the majority of my patients, I can speak for my patient panel, are very trusting of me. And so they wanted to have that conversation. They wanted to know, number one, did you get it? Yes, I did. I took my mama to get it, and if I'm giving it to my mama, and I love my mama, I'm going to make sure that I'm not going to have her take something that I wouldn't have my patients take something as well. So it was more about, for me, in my patient population, reassuring them. I mean, we had Tyler Perry do a 30-minute special on BET. I said, you can educate these people till they blue in the face. That is not going. This was a faith thing. Either you're going to have faith to take it and believe that you're not going to, or have faith to say, I'm not going to take it. Okay, well,
Dr. Buffalo, they asked me, they says, you're a man of faith. Well, I had all the shots, the boosters, everything else that you can give. I'm military also, so I understand that. So he says, well, you're a man of faith. Why'd you get the shot? I said, I'm a man of faith with the shot.
Right.
I said, I'm double covered. Whatever they want to do, I got it. Because we're frontline workers.
Right,
If I'm going to be a man of faith and I'm going to be exposed to everybody, I think you need to do it, you know, because everybody that was not doing it was really getting infected even more as in that second, the Omicron. My daughter, we're in a hotel because my house burned down, and she contracted, it was on a 3-bedroom apartment. She contracted the virus, and I did what any loving father would do. I kicked her out. You know? I sent her to a hotel someplace else. I don't want what you got. You know, and she refused to take the shot. You know, so I'm thinking, y'all gonna stay with me. At least cover yourself a little bit, you know, because if you're not, then there's other results of that.
And Apostle, you said something earlier. Sometimes people would rather be healed than healthy.
Oh, they want to get in the prayer line. And they want you to say, abracadabra, be healed in the name of Jesus. And they want to be healed, but they don't want to go to the Y and walk 3 to 5 miles every day or 3 days a week, or however you're going to do it. And it's the killer because even during COVID, I never called it a pandemic. I call it a plandemic. Yes, I thought because the church was given an opportunity to step up, and we failed God miserably because we failed the world miserably because we were more afraid, like God can't handle a virus. You know, like God can't do this, that, and the other. We shut down for, I think, 6 weeks. We opened right back up in May of 2020. I think we might have had 3 cases. Nobody was dying because faith is powerful. Faith is powerful, but faith ain't faith till it's faith. Some people gravitate to faith when they run out of all other options, and God don't. He's not going to be your 3rd or 4th option. So that's the killer.
You know, it was really hard as a healthcare professional to hear so much negativity about the science behind the vaccines. I mean, and I knew that the political aspect of it had a lot to do with it. But to hear that and then see them struggle was very hard. Because sometimes I was like, well, I want them to see this. Like, can they come here and see what we see inside of this hall? Because then they would understand why it's important to do it. But they wasn't allowed to see what we were doing. Like, they wasn't allowed. We talked about it. They mentioned, Dr. Fauci mentioned it several times about how we're proning you. We're flipping you on your belly. We're intubating you. We're literally, you know, doing everything. We're throwing the book at you with science, the same science that you refuse to believe, which you don't want to take the vaccine, but then when you're on the ventilator or you're getting ready to be on the ventilator, you ask me for whatever you got. The doctor will say, well, we have this experimental medication. We're trying. I'll take it. You'll take that, but you won't take the vaccine that we literally have the entire world looking at. So that was really hard to process. And then another thing about that is the families that did do it. You said that your daughter had caught virus and then you told her to go somewhere else. A lot of families didn't have that opportunity to do it. And so you had these adults, older adults that had children that were teenagers. And so they would go to college and refuse to get their vaccines and then come home carrying the virus. They're negative, but they're carriers of it. So then the family members will catch it, and now they're in the hospital with me. And so that was actually a lot of the population of our patients that we had in ICU because their family member brought it home to them. And so sometimes people forget that you really do have to think about other people because I love you, but I don't want you to get sick. So I'm not going to do something that would hurt you. So sometimes people just forgot that whole passionate and compassion.
Asymptomatic. You have no symptoms, but they're saying that you have something, but y'all medical. If I come in your office and I ain't got nothing, how y'all gonna give me something when I ain't got it? You know, I mean, that's the only thing that I've ever heard of, that you have no symptoms, you have nothing that says this is what you have, but I'm gonna give it. Well, I don't want to be a conspiracy person, but I do think there was a lot of conspiracy behind this entire concept. And so it does, like what our host said, it's a lot of mistrust because of what goes on. And I don't know the negativity of our community. That's why I was saying when I was looking at Tracy, knowing what you do for a living, how do you deal with our people who, you're running for a 25, a lot of how are we going to penetrate the disbelief or just the nonchalant attitudes? And the church is a big part of the problem, because we've gotten up in these pulpits and entertained people for decades. We entertain you, and it's about how we hoop and how we say, we're not giving people the right stuff. And because we're not, it's like the medical field. If I don't give you the right portions of the ingredients that's necessary for you to come out of what you're in. I had a young fellow, and he passed on, and I was telling him, okay, are you going to trust God? He said, I've trusted God, and it has gotten me nowhere. I said, well, you got to do what the doctors do. Increase the dosage. Increase you need more word, man. And believe, if I didn't believe what I believe, I wouldn't get up in the pulpit and tell people that God is able. And he will take you to some places that you don't really want to go to test to see, are you really, there will be a screening process between your faith and non-faith. A lot of people can put on a good show in front of everybody, but when you get by yourself and you got to deal with symptoms and hurts, where are you going to find your help from then?
The church has played a very important role in our lives as African Americans, all the way back to slavery. It's a fascinating documentary on PBS about the history of the Black church.
Yes,
but I've always felt like, we've, as a people, we've made it through slavery and lynchings and Jim Crow and segregation and desegregation, and the church has been there along the way. It was where we came. We got the information. And I've always learned, if you want to get a truth into our community, bring it from the pulpit.
That's right.
And so you're doing something like this, having this at your church.
Yes.
It helps because we trust our clergymen.
Amen.
We do.
Even
so
if we're not trustworthy all the time.
yeah.
I'll just throw that out there.
That's called being a human.
All right.
Right.
Okay.
So humans make mistakes, but I think this is one of the ways.
Yes.
Bringing it through the pulpit, having these type of talks.
Yes.
And I don't know how. He and I actually talked about this because he didn't even know that we have multiple Black internists, we have Black family practitioners, nurse practitioners. I know a Black orthopedic surgeon, colorectal. I say, get all of us together. Get us on the stage. Now, I don't know who you have to bring to attract the people.
Right.
It's a shame that you have to, even with the minority conference, you had to bring, Patti LaBelle, or you had to bring some football stars, people. And it's a shame that we do have to be entertained.
Have to be entertained.
For us to take this seriously. But I would think with what happened, and we have to keep this conversation going. This did happen to us.
Yes.
COVID did expose some weaknesses that we've known that have been around for a long time. And I was just going to get into some of the conditions that he talked about. Diabetes and hypertension and obesity and asthma and the foods that we eat. One of the points was the negative marketing that's targeted towards us.
Right.
I sat and watched the show, and during the commercial break, it started with the latest cheeseburger, went to some buffet, then talked about some ice cream, then had the latest diabetes medicine, and then ended that cycle of commercials with another hamburger. So you can eat this way. You can have this, and oh, by the way, we can treat you. We have this new pill, that will help you to, we can treat diabetes so many different ways now. We can tell the liver, don't make so much sugar. We talk to the kidneys, and we can say, release extra glucose. We can work with the body's natural ability to communicate to the pancreas to make more insulin. We can give you insulin. We can increase your body's sensitivity to insulin. So we have many ways. We can put your insulin in a device so you don't have to stick yourself every night. You can put it in a device, put it on your arm, and forget it, and change it every 72 hours. You don't have to prick your finger anymore. You just put something on your arm, you go to your phone, you can scan. So, and I don't know how I feel about any of that. because it's just making it easy
Yes.
to continue in this disease. You know,
recklessness.
we have drug reps that come to my practice every day, and they're touting the new GLP-1, and these drugs work. These drugs have not just benefits to lower blood sugar, they lower your weight.
Yeah.
They have cardiovascular disease prevention.
What about side effects, though, Doc?
Oh, no, well, every medicine you take
Okay.
is going to have a side effect. Metformin makes you nauseated, makes you have loose stools.
Yeah.
These new GLP-1s, these, I don't want to give any advertisement, but some of these newer medicines cause a lot of nausea, and that's really how you lose the weight, because it slows down the signal between your brain and your gut. But we have many ways now that we can treat. So there's really no excuse to have an and I'm speaking for type 2 diabetes.
Right.
And so there's really no excuse, and there's a lot of information about type 1, type 2. I can go into it, but we are in information age, so you can find all that. But so I'm saying with all that we have, even when I'm talking with the drug reps about their drugs, I'm like, you keep coming up with these new drugs. Why not talk more about nutrition? You know, when are we going to get really serious with America? But it's all about, and I'm probably going to be blackballed, but it's all about money.
Yeah.
You know, it's big pharmacy. It's all about money. These pharmacies, it is so ungodly, the amount of money. Diabetes is really a condition that you really can't afford to have. You know, COPD is a condition that you really can't afford to have. Inhalers are expensive. Insulin can be up to $300, sometimes $600. If you choose the wrong insurance plan with a low payment every month, you got a big deductible, you're going to be paying all that money out of pocket. So even all these new drugs, and we can treat diabetes by many different ways, your insurance won't even pay for it. You know, so I mean, there's a lot to be said. I'm sorry.
Let me jump in really
Yeah.
quick, because I want to change directions just a little bit. So one of the reasons I love my platform on radio and in media is because we have so many different organizations in our area that are of service to people. And so the United Way is one of them. And I definitely wanted to ask Alicia, in your service at the United Way, what have you seen during this time, and how has the United Way stepped up to help the community?
Absolutely. And Dr. Buffalo is absolutely correct. It is expensive to be unhealthy, right? And when we think about health, we also have to think about what is this, what are the social and economic and financial barriers that are impacting people's health. We know that people in poverty are more likely to be unhealthy because, as we talk about healthy food, well, if you don't have a healthy grocery store in your neighborhood that allows you to get healthy foods that you can walk to, i.e. the Y, right? If you don't have a Y in your neighborhood, if all you have in your community are your food swaps is what we call them, right? The fast foods, convenience stores. We also know the importance of an income or a stable job where you have health insurance to pay for these expenses. Our focus is what are those economic and social factors that really impact people's health. And health is wealth, but we also know there are a lot of other factors that prohibit or inhibit or exacerbate some of these issues outside of that individual responsibility that we all take. And so that is where the work of United Way and where we know our focus is and where we put our work is to make sure that people in this community, specifically those people in color and people living in poverty, have these opportunities and have this opportunity to access all of these resources, but also can be very, very preventative. And a lot of that comes with making sure that people have a firm foundation to start on. A lot of the work that we focus in on is around economic mobility. And that means people have the access, the resources, the networks within their own communities to live a stable life, right, and prosperous life. What we know in Greenville County is that if you are in the bottom 20% of income, that's less than $24,000, to move to the top 20% of income in your lifetime, what do you think that is? $1 million? $94,000. So to move from $20,000 to $94,000 in your lifetime, you have a 4.7% chance of doing that if you're in Greenville County. If you are black, you have less than a 3% chance. If you're a black male, you have less than a 2% chance of doing that, right? So that is really what our focus is of what are those factors that are really inhibiting these more systemic barriers that we talk about that are impacting communities of color.
Let me ask you a question. What does stress have to do with with this,
Toxic
because
stress,
I know
yeah.
that we're talking about nutrition and food, but they said hypertension is stress. They said, so
And
those-
people
all
are
those
usually in stress because
factors.
of money, right? And lack of resources. And what we also know is really important in this, especially as we look across lifetimes of children and adverse childhood experiences that lead to toxic stress. Adverse childhood experiences are things like I'm homeless, I don't have food security, I have a parent who's suffering from mental illness, I have a person who in my household suffering some substance abuse. We know that those disparities are innate oftentimes in communities of color. And so that toxic stress exacerbates these access issues, which exacerbates the poor health. And so all of those things are really key dynamics that we have to also focus in as we talk about communities of color around health and wellness too.
And the bad thing about that is stress also holds, a stigma as well. So somebody might be feeling like that, or they might be feeling depressed, but they won't say anything about it because that stigma. Oh, it's easy to tell somebody, don't stress.
Absolutely.
It's okay, that type of
Yeah,
thing.
and
But
that
people need
stress
help.
and knowing we have medical professionals on this on the panel, understanding that stress exacerbates itself, right? And when you're experiencing stress so early in your life around trauma, you carry that with you, and those health issues are just exacerbating. And there's research that shows people in their lifetime who have those adverse childhood experiences are more likely to have poor health outcomes.
And you know what, even in our churches, because we try to talk positive, I teach a positive message. I love that. But you got some people, I'm blessed and highly favored, and they like terrible. They're on the edge of going off the, going postal. But they've been taught to act like, especially in our communities, I got it going on, but then the fentanyls and the drugs that are coming out, everybody's looking for an answer, and we don't have enough, as Doc said, maybe we need to have a lot of these conversations to see where we might be able to touch somebody, because a person like myself, how can a preacher tell people, oh, I'm depressed? You're supposed to know God. You can't tell nobody that.
But Apostle Smith, isn't that to the power of testimony, like the power of testimony in the Black church, or just the power of people telling their story?
If they're real with it, brother, if they're real with themselves, you can do it. I think our biggest problem, we just don't want to be real with ourselves.
But there's just such strength in somebody telling their story. And I want to bring Tracy into the conversation too. So I thought, and don't know if I'll bring up the exact situation, but the power of diversity. I think we've seen in Greenville over the last few days a need for much more diversity when we had a Black History post posted by the city of Greenville, and on that Black History flyer to celebrate Black History was a picture of Mayor Knox White. And so I think we need more diversity. I know it's a health topic, but we need more diversity because we need people who are empathetic, people who know, who can say, I know what you're going through because I've been there. Because it may seem to some people, why isn't somebody going to the doctor? Well, maybe they're not going to the doctor because there's a $35 copay. Maybe they can't see the specialist because there's a $50 copay. So we need people in powers of position that can understand that, because a lot of times we take those small things that are hardships for other people for granted because it's not a hardship for ourselves. And so...
You know what, and talking about knowing that the young man is running for office, that means all this, the churches, the medical field, the communities, it's going to fall on your lap. I mean, now, what makes you feel, I guess I done shifted this thing up, what makes you feel that you understand the problems of this region, and then what's your answers?
Thank you for the question. So I grew up not in poverty, but I grew up, my parents didn't always have the resources for us to go to the doctor, for us to be healthy, for us to have, the greens. So we were the McDonald's kids because it was convenient and it was cheaper. And so I lived that experience, and now that I'm older and I've educated myself, and that's what it goes back to is education. It goes back to people taking the time to educate themselves on what really matters to them. And so as a young person, we have access to internet, we have cell phones, we got iPads, we have MacBooks. And so we spend time researching what we want to look up, what we want to see. We got TikTok, we got Facebook, and all these other social media platforms. And instead of us using it to better educate ourselves, we use it for silliness.
Yes.
And so I think, just being real, I think that, exactly. And so I think that we have to spend time better educating ourselves on what's more important to us and to our families. Even as young people going to the doctor, I go to the doctor annually and I feel just fine. But I go because I want to make sure that I'm here in 20 years and 30 years and 40 years, and I'm not struggling. I'm not on insulin. I'm not taking a shot. I'm not taking pills. There was one time I got a physical twice in 1 year. My doctor said to me, "Why are you here again? You just had a physical 6 months ago." And I said, "Doc, I want to make sure I'm good." And I paid out of pocket for the second time because my insurance only covered the first visit. But my health is that important to me. And so as a young person, we've got to, and even, not even young people, we've got to decide what's more important to us. Is it our health? Is it going to the club and spending our last $25 on a drink? Like, what's more important? Is it the Rams? What's important to you? And when you make what's important to you, when you prioritize what's important to you, then we can start having the conversations about living longer lives, living healthier lives, eating cleaner, eating healthier. Because you see a lot of the white, and I'm just going to be honest, you see a lot of white people eating healthy, and they're eating the greens, and they're eating less meat, and all of this stuff, and they may or may not live longer, but they're at least trying. They're at least putting forth the effort. And of course, granted, eating healthier is more expensive, but again, what's priority to you?
Wow.
And so,
I need docs, and I need your number. If I need you to talk to me, I'll take you out. We'll go somewhere. Because when I'm listening to this information, the power of information, that's revelation. Absolutely. And revelation leads to transformation. And if we can get that and sort of infuse it, oh my God, then everything that y'all doing and everything I'm trying to do might pay off.
but to answer your question,
Yes.
so when you look at like all the policies that are being put in place by legislators at the local, state, and federal level, a lot of these policies have every single thing to do with public health, has everything to do with the way people are living. So if you look at, for example, I'll use, Piedmont Manor, for example, Schumann Crossing. There's no Whole Foods in the area. There's no restaurant that sells healthy food. And so, but when you go to Woodruff Road, you go to Chanticleer, you go to all these other places, you see all these healthy food choices. And so it goes back to the policies that our legislators are putting in place. And so when you look at what the city council is doing, and back to Rhonda's post, and I want to speak about that real quick. It's Black History Month, and there are so many Black people, even on the stage, that are doing incredible work that they could have recognized, but they chose to honor and recognize a white man. And so my question to the city that I posed to the city is, like, who's advising y'all?
Wow.
And so if you can mess up by putting a white man's face as a person of honor during Black History Month, imagine the other things they're doing that's affecting Black people in so many negative ways. We got people like, Jesse Jackson was just in town a few weeks ago,
Right.
and they talk about they're building a Unity Park, but there's no monument, no statue, or anything that's recognizing and memorializing the work that he's done, and he's from Greenville.
Right here.
He's from Greenville. And so we've got to, and I'll pass this to Tracy because Tracy's doing the same work, is that you got to have people who are not afraid to speak truth to power and that will go and tell white people, Black people, because we got Black people in office too who aren't doing the right thing. And I almost said a cuss word, but I'm in church. But you got Black people who are in office who have the power to make policies that will impact Black folks and help us live more healthier lives, and they choose not to do so.
That's true. First of all, this is so much information. It's really good. Like you guys say, we do need to do this more often. However, going back to what Rhonda said about diversity and inclusion, and how we really need to have those true conversations. We can all sit on committees and do all this stuff and go to a meeting once or twice a month, but that post showed that all this stuff they've been doing for the past 18 months is a wash. That's just it. Because somebody should have knew better. Somebody should have known better. But, that was one of those things when I saw it, I thought it was pretty odd. Then I saw your post and I liked it, and I just said, Tracy, protect your peace, keep it moving. Because that's one thing I started doing, you know, when it comes to mental illness and the conversations about that. I feel that as a community as a whole, we need to recognize that that does exist. And I didn't even think about it until I was diagnosed. And I said, okay, so that's what it is. Now I get it. Anxiety, stress, depression, all that stuff is real. And people really function well in those spaces. But it's a whole bunch of broken people walking around here. It's a whole lot of brokenness. And then you look at the past 2 years when we dealt with COVID, and, you know, when I had it, and when my mom and my family, my daughter's family had it, and my grandson, who was 1 year old, had it. I never posted about that on social media. That's why I tell people all the time, treat everyone with kindness, because you never know what someone's going through in real life. So my husband got it, and I started noticing that people with COVID, or all my friends started having heart attacks. Everybody I knew had something going on with their heart. And knowing that, you know, he had like a high cholesterol and all this stuff. So before his COVID diagnosis, I started saying, listen, we need to focus on your cholesterol. I feel that if we hadn't changed the way we live, our diets and everything, that could have affected him in a negative way as well. I thank God it didn't. But, you know, a lot of us don't go to the doctor because we're afraid of the diagnosis.
That's
You
the
know?
truth there.
Yeah,
That's
you see your family, you see your family history,
Yeah.
and you start getting an ache or a pain somewhere, and you're like, bro, that might be such and such. I'm gonna walk around here, I don't even wanna know.
That's
If
so
it's gonna
true.
take me, it's gonna take me. And then we go years and years, then you go to the doctor and you got stage 4 cancer.
Yeah.
You know, so, I mean, I can go on and on, but I'm just saying, you know, we really need to continue to have these conversations and get, you know, knowledge, not be afraid of it. You know, a lot of us, we literally operate in a space of fear right now. COVID, it swept through my entire family, and I was terrified.
Yeah.
I'm not gonna lie, I've had it twice. You know, so I just was like, man, but when my grandbabies had it, that shook me up. You know, the youngest one, he was like maybe 11 months old. You know, and the doctor was like, it ain't really nothing that we can do. We can just watch him and keep him hydrated. And he had days where he just laid around.
Yeah.
That right there, you know, so I'm thankful. I'm thankful they survived and we survived and everything, and I'm thankful for this conversation. I think I said enough words.
Yeah, and
Dr.
Rhonda,
sorry, go
your
ahead.
question around diversity and inclusion is a really interesting one, and I'm really linking that with what Dr. Buffalo said around we can't continue to fight this battle alone. We've been fighting our battle a long, long time by ourselves, right? And defining what allyship looks like, defining what holding this community accountable and people who don't look like us accountable, and sharing this load, right, that we're working on. And I think that that's a deeper, more complex community issue that we have to continue to keep front and center, and that we have to continue to think through around what this means to be a much more equitable community, and everyone should be fighting for that, right? Regardless of color. And so I think that is where we hope to see community strides in that space.
Can I say something? I love what all y'all beautiful. Early childhood education.
Yes.
This is where you get, you know, those early ages is where habits form and patterns form. Have we, like, you know, even with the South Carolina lottery, they were putting the money on the back end, okay? I figure if you're gonna have a lottery and you got this many billions of dollars going, put the money on the front end, because by the time they get to the back end, it's too late. So when it deals with physicians and doctors and having a complete military, VA checks me out every 6 months, you know. I'm good. I'll be 65 soon, but I'm good for what God is doing for me because I think right. If you think, and Paul said, I think myself happy. So a man thinketh, so is he. So when your thought is good, a thought leads to an action, and an action leads to a habit or a pattern, and a habit or a pattern leads to a lifestyle. So by the time we get beyond that thought, and if it's not good thinking, we don't have these intelligent people sharing with somebody that may not be. But I believe that we have a chance to catch them early if we understand what we need to do.
Yeah, early childhood learning is critical. Early childhood learning starts prenatally. It starts with maternal health. It starts with access to health care. It starts with prenatal health care. It starts to reading with your children, right? That's when we talk about early learning. It starts before birth. And until we, as a broader community, understand that, right, I think we will continue to feel like we're always trying to catch up.
Trying to catch up, yes. We asked some questions Sunday, and I didn't give them the easy Black history questions, Martin Luther King and Soldier of the Truth. And no, we started asking about some people, and those kids looked at me, they says, can we Google them? You know, they wanted to Google, and I said, it's apparent that our parents are not parenting. And so it's something where the Xbox and the PlayStations and the iPads have now been the new parents, and we're not communicating with our children. And I'm glad I'm old enough now, I don't have no babies like that. But I know it has to be difficult because if we're gonna be on par with the world, Asians and Indians, they get them at 2 and 3 years old. And we're still trying to, make them happy and buy them Jordans and stuff, we should be trying to put education in them.
And educate our parents, right? So I think, I'm not a parent, but I'm a proud auntie.
Right.
And every day my niece and nephew are teaching me something. I'm like, so that's how you're thinking. That's how you're growing. That's how you're developing. And understanding how to equip parents and eliminate the stigma around parent education, right? I'm not a parent, but I have a lot of parent friends, and parenting is tough. Like, everyone needs support as a parent.
Right.
And until we can eliminate what that stigma is around parent education, how you need support either with your peer network or through your church, that's some of the work we're doing at United Way, is how to equip even our church community with parent education opportunities, that they, again, as a trusted space in this community, that they can be really those vocal points around how we help our children through our parenting.
Wow, we have to partner together. Like, the medical,
Absolutely.
the social, the faith-based, all of us, we need to get this thread and put it together and bring the upstate up. And I think it could work.
I wanted to add something to I wanted to add something to what you just said about bringing the children into the conversation and also addressing the fact that the parents may not know also. But as it relates to health, we have a program that we were doing with children and teaching them about health, teaching them about the cardiovascular system. How does that heart work? Why is it important that it works, and why, and what is it doing for the body? That kind of conversation, having that kind of, even if you're not in medical, but talking to your children about the benefits of healthy eating, a healthy lifestyle, walking, working out, exercising, all those good things, drinking more water, putting the sodas away, like just changing those little things. Inviting the children into that conversation is also something that we should do. We do live in a day now where kids are asking questions, because if you don't tell them, they'll Google it. So you better let them know.
Yeah, talking about it and modeling it, right?
Absolutely.
So I learn something from my nephew every day, it feels like. And the other day I was like, what was your homework? He's in preschool. He's like, to drink water. I'm like, so that means I can't give you this Kool-Aid packet, right? Because that has been your homework, to drink water. And I think that is part of this modeling that also has to happen. And it is hard to teach children, these are all the things you should do when I may not have access to get those fruits and vegetables, or I'm working 3 jobs, I'm gonna have to swing by the fast food restaurant to make sure you eat before bedtime. So I think those are all things that education piece, that modeling piece, and also that access.
Well, do we have to wrap up, I think, Derrick? No, because this conversation could go for so long. And I think, and that's one of the things I was talking about earlier, where every night I would have a meat, a starch, and a vegetable. And you can get into the whole talk and discussion about is leaning towards more of a plant-based diet, and talking to our children about more of a plant-based diet beneficial. Like, you don't have to eat meat every single day. I mean, some of us eat it for breakfast, lunch, dinner. So, I mean, I just think there's a whole different way of thinking.
One of the things I did that was very key, and I'm not gonna say anything else, but I took a healthy cooking class at a church.
Okay.
And it was an 8-week, they brought in a professional chef. This is when I first moved to the upstate. And I learned about things like bok choy, rainbow chard, you know, and how to prepare vegetables differently. I learned about low sodium seasonings like Herbamere, Perfect Pinch, things that don't run up the blood pressure. That's very key. And even with you're partnering with someone that teaches how to right. And so that's excellent. And you bring up plant-based, and this is probably the last thing I'm gonna say. Yes, I mean the healthcare community is really moving towards pushing our patients towards a plant-based diet. I mean, there's been evidence out there that you can reverse atherosclerosis just by putting away the meat, getting your protein from soy, you have tempeh, tofu, seitan, SVP, TVP. You have all different types of sources of protein. And if you cook it right, it'll take on whatever season. Now, you can have unhealthy, believe it or not, unhealthy plant-based, but there are, I'm sorry. Yes, you can.
Oreos are vegan.
Yeah.
So,
so are French fries. So,
French fries are vegan.
Yeah. No, but it's been clearly demonstrated. There are all kind of documentaries out there about it, Fed Up and Forks Over Knives, that will really blow your mind as to the processed food industry and the taste bud thing. I mean, sugar is in some studies, sugar is more addictive than cocaine.
So,
Yeah, they've done all kind of studies with rats. They give them sugar, give them cocaine, and they went and hit the sugar each time. They looked at the MRIs of individuals where they can light up different parts of the brain. And excuse me. And when you see it, when you see the sugar, you see the cake, the feel-good part of your brain just lights up.
It makes you feel good.
And listen, and the more you feed that part of your brain, the more it grows, and the more you want it.
So I have a question. So one thing that I've noticed that in every area where there's a food desert, or every hood, there's like Family Dollar and Dollar General stores. They sell very unhealthy food. What can we do? Like, how can we help in those areas? Like in Condesi, for instance, right? I bought some land in Condesi. We're going to have a community garden there. You know what I'm saying? It's going to be beautiful. It's going to be fabulous, I'm telling you. But, so we're doing that, and we're going around, letting the people know, and the community is going to help. But it's also going to be a rehabilitation garden. So it's going to be like a combination of things. They can come and do yoga, all kind of stuff. It's going to be real peaceful, you know what I'm saying? But besides that, like everybody doesn't have the ability to go out, buy a plot of land, tell the community, let's make a garden. But with these Dollar General stores and these Family Dollar stores on every corner, it's like when I grew up in Detroit and there was a liquor store in every corner. Now it's like they're just popping up all over the place, especially right there in District 25. Like there, it's like the whole circumference. You know what I'm saying? One across the street from the other. Then it's a Dollar Tree store, but they all sell those very unhealthy, high sodium meals. And they're quick meals. And so people go and buy them. So what can we do as a community? Does anyone?
Beautiful. Yeah, totally, make sure.
I think one of the things that we can do is what you just mentioned that you're doing is not necessarily buying the land, but there are churches that have land that just sitting there, going to those churches and saying, hey, can we use this land to do something beautiful for our community? But also, all of us on this stage, we all have our different expertise, and us coming together tonight was not just to have a conversation and go home and then forget about it, but it was more so to...
Derrick, let me say something before you wrap up, because I think you're about to wrap up. So I do want to speak to that as well. So Maranatha Church, which is off of Easley Bridge Road, has Maranatha Farms right behind it. Wow. Incredible. You can go, I think they're down right now, but you can go on Sundays, you can pick vegetables, and it's very, very affordable. Also...
Rhonda, when they said, I didn't want you to get off, I got medical people up here. What is our thought or our take on medical marijuana? Nobody said nothing.
I don't
You
think
know
they
what-
do that at Maranatha Farm.
I mean, we gonna grow something.
But you can get your vegetables and
I mean,
produce from there.
does it work, Doc?
I support it.
Does it work?
I-
Does
you-
it work?
Let me tell you something. I actually, there are several studies out there, and I'm sure Dr. Buffalo can attest to some of that as well. But I'm going to speak on just patient care aspect of that. And there are studies out there to treat for cancer patients, as far as pain and, right, and epilepsy and
I'm gonna say this, and I'm not gonna say nothing else. I will tell you, especially in our youth, okay? I have not met, and I hope I'm not shooting myself in the foot, I have not met anyone that has been highly productive that smoked marijuana.
Really?
I mean, I'm just being honest with you. I'm not trying to offend anybody. And I'm telling you, this is what I see when I'm
On a
talking to
regular
the youth.
basis,
Right.
like on a regular basis.
Right, I'm talking like when I see the youth come in and they're having all these troubles. I'm not saying like, I'm talking in my practice. And they're having all these troubles and we're talking, they can't figure life out, they can't, and you ask them about their habits. Yeah, I smoke every day. I'm just being honest with you, marijuana is an evolutionary drug. I mean, you just want to smoke and chill, and that keeps you from being productive. Just like you said. Now, unless you're going to go in the studio and lay down some tracks, but I'm gonna be honest with you. I don't know. I mean, Snoop Dogg, I know, and I'm not. I hope I'm not shooting myself in the foot, But I tell the youth, I have not met one person when I get a social history. What do you do for a living? I'm a banker. I'm an attorney. I'm a physician. I'm a minister. And I smoke weed every day.
They're not gonna say that. Right. Now, is there any questions out there that's anybody gonna have before we get out of here?
Are we taking any questions? Anyone have a question for any of the panelists?
Come up, I think we got some microphones up here or something. Yeah, you got to leave your seat, bro. On this side. Beautiful stuff tonight. This was good. I like this.
So y'all talked about like not having access to like certain foods. So what about like things like HelloFresh and Blue Ribbon? Are those good healthy options, or some things wrong with those things?
those are great options if you can
Dr.
afford
Buffalo
that.
said it, and I'm going to quote it, if you can afford it.
It's
Yeah,
expensive?
they're expensive, especially for a family. They tend to be pricey, yeah, and so that can often limit access to.
What is that he just, because I didn't,
Like meal delivery boxes that you prepare. They have fruits, they have vegetables, that kind of thing.
She had a really good point about the Dollar Generals or whatever, buying those foods. Those canned foods, you still can eat them and make them healthy. You
Okay.
just rinse them first. Rinse the sodium off. There's things that we should be teaching people how to prep stuff that you can utilize those resources to still eat healthy. Like if you want to have the box noodles, the hamburger helper or something, then maybe you can not use the sauce packets there and make your own sauce, Instead of using that high sodium packets, you can utilize the same resources that we have. We also teach a nutrition course where we talk about, well, what do you have? Let's work with those free hamper meals that you get from the donation places. You really can. I mean, you
Don't
really
use that
can.
packet if you're gonna
You
make those
absolutely-
ramen noodles. But just healthy food, I want to bring this up again, but Pastor jumped in with the marijuana question. But I think this is just really so important that our community knows that they don't have to go without.
Yeah.
Because there are organizations. I'm so blessed to work right now with Mill Village Ministries, and we have Mill Village Farms. I also know Maranatha Farms, which I just talked about. They just got a grant and created a community garden at Upstate Circle of Friends that is amazing. So please take advantage of that. Also, so through Mill Village Farms and Food Share, you can get healthy boxes of produce. I mean, the produce is beautiful. $25 value. If you're on SNAP or EBT, you get it for $5. And then,
That's really good.
we knew that we were getting this healthy food out, but also wanted to let the community know healthy ways to cook it. Like, you don't have to fry your vegetables all the time. So we do a cooking show called Fresh Out of the Box with Food Share. So not only do we get these boxes of healthy produce out, we have a show that night that the box comes out that says, this is what you can do with the produce that's in your box.
That's awesome.
Yeah, it's amazing. And so this week alone, there were Brussels sprouts and broccoli and mustard greens and pears.
They're great boxes, yeah,
Yeah.
they're great boxes.
They're great boxes. So yeah, so I don't ever want to leave without letting the community know that they do not have to go without.
Yeah,
And so just
absolutely.
log on to foodsharegreenville.org and you can order those boxes and get one every other week.
Good stuff.
That's good.
I got one more. So I know one of the issues you were talking about was like having access to, money and, the balance there. I know a lot of like the jobs in the upstate are manufacturing jobs. And a lot of those jobs pay a lot more, but sometimes working there is stressful. You're not in the sunlight for most of the day. You work long hours. Do you see more health issues out of people that work manufacturing jobs?
That's a really good question.
Yes.
I'll let Doc
I have
have that one.
patients that want me to write them out for the week. I'm not making that up. They bring in paperwork and they're like, can you please write me out for a week? And I'm like, you working every day? Literally 7 days a week. I said, isn't there a law against that or something? And yeah, and it's, I have seen that, and I really would love to go out to some of these places. I'm not going to say any of their names. And I've actually had this thought. I said, maybe I should go out there and say, hey, this is what I'm seeing, and I don't want to break any HIPAA violations, but there are several big name ones where they will come in with some condition and say, can I get a week off of that? Or can you fill out my FMLA paperwork so I can get 2 days off every 2 weeks for the entire day, so that they can walk away and have some time to unplug. Yes, you will work yourself to death.
Yes.
And
I worked at BMW for 17 years. I had 9 surgeries.
I didn't want to say any.
9 surgeries.
But, it also goes back to educating people and encouraging them to see their doctor regularly. And if you don't have a primary doctor, showing them resources that they can go to in our community that can go to these clinics that do sliding scale pay, where they really, if you don't have insurance, but you still can see a doctor and you still can go there. I think New Horizons one of them. And then they also have sliding scale for your pharmacy, your medication. So if you don't have insurance and you don't have a primary doctor, you should really be taking advantage of having your yearly exams and checks. So I think it goes back to teaching people to be aware of yourself. I mean, I'm full on education. You really got to know better to do better. And so for people to just piggyback off of your question, I think people just have to learn how to take care of themselves. And if you understand that I'm working too hard and I'm really stressed out, I really should go and take a break, and I need to go see my doctor just to make sure I'm healthy too.
That goes back to a whole lot of economics and everything too, because, gosh, these jobs, some will fire you for taking this time off. And about the 7 days a week, they're probably having you work just that number of hours that they can get away with it. But we do have to have this discussion again, because that goes into a whole other discussion of self-care. And like I always like to say, self-care is not selfish. But for a certain group of people who are underserved, self-care sometimes is not possible. So one more thing too, we talked about the YMCA earlier. Another resource to know, to let the community know they don't have to go without. The YMCA will never tell you that you cannot join because of you don't have enough money.
Oh, that's good.
There's a program, I think it's called Open Doors, or they might call it the, I can't remember. But if you go to the YMCA and tell them, Open Doors? Yes, the Open Doors program, and let them know that you're unable to for financial reasons, they will work with you and you'll be a member. They will never turn someone away for not having. Right, they'll bring it, like I think you said, like maybe a sliding scale or something, but they'll make it affordable for you.
Based off income kind of stuff.
They charge me the full price, so
And they should.
That's right.
I have a few questions. I'm not going to hold you too long, but a few comments. I'm Angela. I'm actually a nursing professor and a nursing practitioner. Wow. I've served on these committees probably 2 or 3 decades. And so we
have discussed these same issues. I served on many boards throughout.
Fix your mic, son.
Throughout Greenville County.
Bring the mic down so we can hear.
I think I'm loud enough. I talk very loud. So some of the things that I wanted to just reiterate and to, I guess, just a summary. You and I, in our area, we're dealing, our numbers are, I don't know the latest statistics right now, but the average mother, probably the age is about 15 to 24, the young mother, unwed. So you have children raising children. So when we're talking about health and wellness, there's a component in there that a lot of the parents today don't know how to be parents. They don't understand health, wellness, finance, resources. So it goes back to how do you bring the schools into this? We used to, when I served on the board with the Urban League, we had a program where the Urban League would go into the schools. They had counselors in the schools that would reach the kids to help teach, bring that family together to talk about finance, resources, and all of that. So that's a big thing. The other thing that I wanted to iterate is that most all hospitals now have hospital sponsorship programs.
Yes, they do.
That a lot of African Americans don't realize that they have. And so when you have a health issue that really warrants immediate care, heart issues, you need to be, have a cardiac cath or something like that, or cancer. There is the Duke Endowment and all the S.C. Johnson provides millions of dollars to hospitals for sponsorships. So we need to educate the community that those things are out there because people will not seek care when they know that they need to have surgery.
Yeah.
So those sponsorships, and unless you have a house, and the numbers are very high, if your property is not worth more than $250,000, you can qualify. There are nurses that qualify, so you can qualify for that. The other thing I wanted to talk about, and this is to Dr. Buffalo, a lot of the physicians and practices are moving away from rural areas now, and a lot of practitioners are specializing. So you have so many families that's in the rural areas, and we know that the buses don't run out there anymore, because that's even cut back in our community. So it is really, so they don't have access to a clinic to help them, and there is no medical doctor there. So how, when you're talking with people and your practice, kind of how do you, Simpsonville is a thriving area, how do you reach those people in those rural areas?
Before I came to Simpsonville, I worked in Lawrence County,
Yes.
which is a rural area. And a lot of them followed me. Probably a good 50 to 60% of that patient population followed me. There's always one person. There's always one town doc. You have at least someone there. But if they want good health care and they have transportation, and they're like these Uber-type transportations that will go into these rural areas and bring them in for their health care appointments. They do have things like that.
Yeah, and unfortunately, most people can't afford it
Yeah.
here. So being in rural areas is a big issue. And I know that some of the hospital systems, I know Prisma at one time had the NP buses that were going out to the rural areas. Because of that funding was cut, so that stopped. A lot of our African Americans utilize the emergency room as their primary care doctor.
Yep.
And so healthcare is burdened down, and there's a lot of bad debt. And it makes it very difficult for those that really do need service to get service. When you go see the emergency room, they're only going to address you for that symptom,
Yep.
for that particular time. So we've got to do so much education. I agree with the panel that we have to bring in the players in our community. The CEOs, the corporate, and you look at corporations. I worked on a research project as part of Prisma, and we were looking at companies that no longer offer health care benefits. I mean, 75%, well, they've changed, 75% had changed their policy and their health insurance, but about 40% of bigger corporations now don't even offer a very decent healthcare plan. Wow. It's either high deductible plans, and so people, even though they're working more and working harder,
Yep.
they are limited in how they can take care of themselves and their families. And how do we address that? And the United Way, I would love to learn more about what type of model you're using to really address healthcare disparities with that new grant.
I'm not sure what grant you're talking about, but I'm happy to, to talk offline.
United Way had received a grant to help with, it was focused on health and wellness.
So there are a few things that we are really uniquely positioned at United Way to do. We, in very few cases, are a direct service provider. We have a few direct programs like assisting people getting their taxes done. We have a 211 hotline that is really aimed to be a one-stop shop for people who need resources and need more information, right? And so what we are really well positioned to do is look at needs across a community. And so I keep saying, like, we lift ourselves 50,000 feet up and say, gosh, this community's suffering, and this community's suffering, and this community's suffering. Like, what is going on? And then we pull the players together to do that, right? So then we pull business community together. Then we pull healthcare together. Then we pull the nonprofit sector together. We pull funders together and say, gosh, this is the issue that everyone is facing. We need to come up with common solutions around this. So that's really where our sweet spot is as United Way to be able to do that.
So, Dr. Buffalo, do you, like, for individuals that want to have a private care physician, what type of options do you offer?
If they want a private care physician, what do you mean?
Like you, instead of going to just like a free clinic, or, because we know that the care is not the same there.
Well, if you want to be a patient at Grace, all you have to do is make a phone call, or you can show up to the front, and they'll get you in. We're open.
How?
I mean, well, number one, we take pretty much all insurances, and if you can't pay, we do have a portion of cash pay, and I do have a portion that I write off every year. So I don't turn anybody away, and my partner's sitting right behind you, and people know that they will just walk into our clinic. Sometimes they don't even have appointments, or they're a day early, or they just need some help. And whenever they come see me, whether they have money or not, now, of course, my staff don't like that, my front office don't like that, because we have bills to pay and salaries to pay, but we pretty much see anyone that walks through the door. But I do have a portion of my budget that's set up to provide free care.
And for transportation, just to add to what you said, Ms. Angela, people with Medicaid can get transportation to the doctor's office, just so people know that. You have resources to still be healthy. You just got to utilize them, ask the questions that you need to know. But those that have insurance with Medicaid can be transported to their doctor's office for their appointments and stuff.
Greenville does have a really bad transportation issue, though. Really bad transportation issue. When I first came here, I was like, where's all the buses from New York and LA? I'm like, where are the transportation? How do people get to their job? I mean, I was just recently, I don't know if you know, Derrick, that the Greenville bus system increased their hours, because at one point the buses stopped running at what, like?
Either 5 or 7, yeah.
Right.
Yeah.
So we had to have 1 million meetings for them to increase that.
Right, so it's.
It was a lot, that was a lot of work.
I never see a bus. I don't know
In
where
some
they are.
areas, but no. Yeah, that's just,
Sundays have changed.
And this last question is for Derrick. So Derrick, with all of this with your campaign, understanding where all the disparities are and all the challenges that exist in the African-American family, and the dividedness in our families and in our race. Our race is so divided. We come together on special occasions, but to be able to rally around getting the education that our kids need and making sure that the school districts are accountable, making sure that, the K-4 programs are in place for the kids and they get the right start and that people have access to prenatal care. So what's your campaign plan?
So one of the things is what we're doing tonight is bringing a panel together like this. And as I was saying earlier, this panel is not just to come and talk about like what we can do. It's to put actions behind our words. And so all of these people on this panel tonight, I'm inviting you to, because like you said, you wanted to go to these corporations and say to them, these are the issues that I'm seeing for my patients who work for you. You going alone may not make a difference, but if all of us went to that Magna, BMW, whomever it is, and said, these are the issues and we want to talk about it, I guarantee you they'd be more open to listening to what you have to say as a medical professional and what we have to say as community members. And so we should start a task force because, as you mentioned, Coretta Scott King was involved. Like, we got to get involved. If we have to march, I'm tired of marching myself personally. I know Tracy is. But if we got, well, Tracy not marching. But whatever we have to do to, number one, mobilize around the issues and bring awareness to those issues so that the people, the powers that be, so we get their attention. And then we move in and start talking about the issues one by one. We got this issue, we need a solution. We got this issue, we need a solution. And we don't stop, we don't let up until the people in power give us what we need because they have the resources. They have they have a ton of resources. And so, you know, and I'll just use, you know, communities like Five Forks they don't have to beg for, you know, nice roads and nice and sidewalks. District 25, we've got to beg for sidewalks. And that is a public health crisis because you got people walking in the streets that get hit by cars and 25 at a higher rate than any other district in Greenville County. Yeah. And so we talk about health, but all of these policies that are being created are a public health crisis, and we've got to deal with them. Affordable housing, even pre-K. You know, getting kids in school at a very young age out of their home environment so that they can learn from someone other than their parents, because their parents, as you mentioned, are 15, 16, 17 years old, and what do they know? They know TikTok, they know Facebook, they know Instagram. And so putting them in an environment where they can learn from other people who have other experiences, who don't mind sharing with them, you too can do this, you too can be that, you too can eat healthy, you too can, you know, be a better person. And so that's where we start. We start by having these conversations and then moving into building coalitions and moving into holding people accountable and not letting up until we get results.
I like that.
Health and wellness, but you got to build up that man so that he can be there for the family and to create that strong entity that we need, that we saw 70, 60 years ago, where we had all the teachers, you know, all of those people doing everything that we could admire, like Harlems, you know, and Oklahomas, all that stuff. So do keep that up. It's very important. And you guys have done a great job tonight. Thank you.
That's an engineer from Clemson, so ain't no telling what he means.
I think I was listening to a podcast or something one time, and they were talking about mental energy. Is that a thing? And is that a thing that affects? Do we have low mental energy in the Black community versus other communities? And they were talking about things like good cholesterol and fatty acids and stuff like that. Is that a thing?
Are you talking about like good cholesterol versus bad cholesterol?
Or like what could I do to, you know, extend the amount of time I can do like an intense mental activity?
Well, you know, there's a such thing as mindfulness. I'm not sure if you've heard of that before, but mindfulness is literally when you take your mind on an exercise. Yeah, you literally train your mind to focus on certain things or not focus on them. So it's kind of like a yoga, but it's more of a training that you use. And yeah, it's meditation. So it's a technique that a lot of healthcare professionals do suggest, because in those mindfulness, you are able to literally focus your energy to a level where you can decrease your blood pressure, you know, if you are de-stressing or relaxing enough to do so.
Just like we teach here, the Bible said meditate therein day and night. The word meditation comes from the word where you get medicine. And so it sends a time release energy throughout your body. Paul said, I think myself happy. When your mind is strong, when you have substance in your belly from your thought, because everything comes from your brain, the chemicals that comes from the stresses that you have now overcome. That's all God is about, enlightenment. And whenever we deal with enlightenment, we overcome some of the beggarly elements and things that got us messed up in life, you know. So it's really more than just a secular humanistic idea. Now you're dealing with a spiritual enlightenment that elevates.
Self-care is not selfish. You know, you just really got to step away from things. When I become overwhelmed, I just step away from it. I shut everything off, and I don't feel bad about it. You know, I used to be like, oh my God, I got to do it. Now I'm like, you know what? I got to protect my peace. I got to protect my energy. You know, I got to just put everything into good things, have great thoughts. So sometimes, you know, I just go in my bedroom and turn on some music, light a few candles, just have some time to myself, because you need that. You deserve it. And that's what you have to say to yourself. I'm deserving of this time that I'm giving myself. I've given enough to everyone else. Now it's about me. And once you get into that mode, it's about me, things change.
And you know, and just medically, that's just your mental health. Mental health for Black people sometimes is a bad word. It's that thing we don't talk about. It's that thing that makes you different than everybody else. But the truth is, we should recognize that mental health is serious, and it negatively affects our community more than we think. We were trained to be tough in our minds and deal with it and not show weakness, especially our men, and not express yourself, because that's not what we do. We don't talk about our business. But therapy is great. You know, therapy is a resource, it's a tool. Some people believe in it, some people don't. But the truth is, mental health is something that negatively affects us, and we don't talk enough about it. And that also ties into mindfulness, being able to be aware of my thoughts and being aware of my surroundings and being able to center yourself. All of that is related to your health. That is health. And that is something that people should talk more about.
You know what, even professional athletes now, who's making millions of dollars, are now dealing with mental issues, mental stress, and mental health, and they can't handle a lot of the stuff. It ain't got nothing to do with no money. Wow.
Like everything can be going smooth in your life. Everything can be perfect relationship, perfect bank account. Every scenario is working out, and all of a sudden you crash out because you never shut it off. Yeah. The best thing I could have done in my life is taught my 6-year-old grandson how to self-care. Self-care is the best care, you know. He's 6 years old, and he'll sit there and meditate. He'll take some time to himself if he feels himself getting overwhelmed. But that's training him for when he becomes a teenager, when he becomes a man, he'll know how to, instead of overreacting and overplaying things in his mind, he'll step back. We have to start when they're small. We have to start when our children are young and teach them that self-care is the best care. Yeah.
And it's what's downloaded, right? I know he's gonna, I'm done. It's what's downloaded into you. You can't think what's not in you. Something has to be downloaded. The software has to be in you. So, you have to have the right stuff.
Well, we have to wrap up, but I do want to say that the power of the word no is an incredible thing. It is an incredible thing. And just also, and I'm going to close out, Derrick, I promise, but when Franchetta, you were saying about, we don't talk about those things. it just reminded me that we, as parents, my son is grown now, but take all these different moments to teach your children. Like there's a popular movie out right now called Encanto, and a character named Bruno, and nobody talked about Bruno. And so these therapists did a whole article just talking about each character and how they fall like on the mental health spectrum. And so there's these little moments that we can just use to talk to our children through.
So when I was growing up, our parents used to say, you know, you keep crying, I'm gonna give you something to cry about. They make us stop crying. Well, my grandkids, I let them cry. I said, no, you can cry because that's an emotion. You know, you can cry, let him have his moment, he'll be back. Instead of shutting it down, because as adults, that's why we don't know how to filter our feelings and emotions, right? Because we were taught to shut it off. So Derrick, next time you want to cry,
Well, I just want to say thank you to everyone on our panel tonight. The discussion could go on for so long, and we definitely must do this again. Thank you for everyone who came out and everyone who is watching. Thank you so much for joining us today for the Black Health and Wellness Town Hall.
Good stuff.
all over it. When we got to that mental health, though.
You know what? I wish more people.
About that, though. We should do one about mental health.